Okay, next we're going to take a look at epithelial tissue. This is a tissue that lines and covers. So it generally organizes your body, kind of separates things. There's actually two types of epithelial tissue: proper epithelium, which is probably what you're thinking of, and glandular epithelium. Proper epithelium is the one that covers and lines both the outer and inner body. Epithelium that is proper can be found inside your body, lining the inside of hollow organs. So, the inside, essentially, of all open body cavities. It's also found in serous membranes, and we can also find proper epithelium outside your body. So, it makes up that upper layer of your integument or skin called the epidermis. But we also have glandular epithelium. So, this forms glands, and it can secrete things like hormones or other substances like oil called sebum, or even just saliva or sweat. So these two types are what we will focus on. So let's look at proper epithelium first. Well, proper epithelium is avascular, so it's not associated with any blood vessels. Instead, it actually gets its nutrition from the blood vessels that are in nearby surrounding connective tissue. So it gets its nutrition via diffusion. Now, inside the body, proper epithelium is generally called mucosa. Outside the body, it's called the epidermis. But no matter where it is, it doesn't have blood vessels, so it is avascular. There's different varieties, there's shape and number of layers classifications that we want to talk about in order to look at epithelial tissue better. But before we move on, we also want to talk about the orientation of proper epithelium. It's always in sheets with cells closely packed together, and these epithelial sheets have sides, or polarity. You have one side called the apical side. This is towards the free space. Another side, called the basal side, is toward the connective tissue basement membrane. Now, if you have the epidermis on the outside of your body, yes, the free space is kind of towards the top, or superficial. And the basal side, where we have the basement membrane, is something you can't see, and it's under the cells, or it's deep. But that's not always the case. In the case of a hollow organ, where the epithelial tissue is on the inside, the apical surface is just towards the center or towards the free space of the lumen or cavity of that tubular organ, whereas the basal side is towards the outside. So it's going to be closer to connective tissue that's deeper, away from that open space in the organ. So how do we name epithelial tissue? Well, based on shapes and layers. So there's two different layer naming systems. You can have simple epithelium or stratified epithelium. So if you have a simple epithelium, this is just one layer of epithelial cells. Whereas if you have a stratified epithelium, this is two or more layers of epithelial cells. Squamous, cuboidal, and columnar are shape classifications. Squamous shaped cells are flat and scale-like. Cuboidal shaped cells are cube-shaped cells. They usually have a central round nucleus, and they're about as tall as they are wide. And then columnar shaped cells are column-shaped. So their central nucleus is usually kind of elongated, more oval, and they're going to be taller than they are wide. So this is our naming system that we're working with. So we can start to put that information together. Simple squamous epithelium is one layer of flat cells. Stratified squamous, though, many layers of flat cells. When it comes to a stratified epithelium, we use a shape name that matches what the cells at the top of that epithelium look like. So if you were to actually look at stratified squamous, many of the cells near the basement membrane look more cuboidal in shape, but as you move towards the top of the many layers, the cells flatten out. So that's why stratified squamous is called stratified for the many layers, and squamous because the apical cells are flat. We also have simple cuboidal, one layer of cube-shaped cells, simple columnar, one layer of column-shaped cells. These cells oftentimes have on their apical surface cilia or microvilli. Structures like that are going to always be on the apical surface of epithelial sheets. There's also pseudostratified columnar, which is actually just one layer of irregular shaped cells. They may give the appearance of more than one layer because of the staggering of their nuclei, but the term pseudo and pseudostratified means false. So this is a falsely stratified, column-shaped cell, where all the cells touch the basement membrane, but they don't all quite get up to the apical surface, creating that staggered effect. And then we have transitional epithelium, which is a stratified tissue, but it's so named because this tissue can change shape. When this tissue isn't stretched, when it's not distended and not stretched, the cells at the apical surface have a dome shape, but the cells can change shape when stretched and would look more like stratified squamous. So where are these epithelia located? Well, simple squamous makes up serous membranes. It's also going to be found inside of your heart, inside of blood vessels, inside the lining of lymphatic vessels, but most importantly in the air spaces of your lung. Simple squamous is a very thin tissue, so it's great in places where we need just kind of a thin lining, but also where we might need filtration or diffusion, because it's so thin that things can move through it very readily. There's also stratified squamous, which you may not know this, you're probably pretty familiar with. Stratified squamous epithelium makes up your skin, or the top layer at least, called the epidermis. So it's outside the body, making up the epidermis, but it's also inside the body, lining the anal canal, the oral cavity, and parts of the esophagus. There's also simple cuboidal, which we find in a lot of glandular ducts and certain small tubular structures like kidney tubules. There's simple columnar, which lines much of the lower digestive tract, kind of stomach downward. We also find it in the bronchi, uterine tube, and bladder. Again, this is the type that often has cilia or microvilli. It actually has microvilli in your intestines, and that increases surface area. So simple columnar with microvilli is great for absorption. Then we have pseudostratified columnar epithelium. So this lines most of your upper respiratory tract, including your trachea. And it's going to be able to produce mucus and use its cilia, which are often present on these columnar cells, to move trapped pathogens or things that cause disease up towards your mouth so we can get rid of them or swallow them, and our stomach acid can handle them. And then transitional epithelium can change shape because it lines locations like the bladder, urethra, and ureters, which at some points may hold quite a lot of volume. And that volume would generally be urine. So when the bladder needs to stretch or produce more space to hold more urine, that's possible both because of muscle and transitional epithelium. So what are we seeing as kind of generalizations? Well, squamous cells are flat, so it's easy for materials to move through because it's a thin membrane. They also help reduce friction when they line the inside of a hollow organ. Cuboidal and columnar cells, they're much thicker, especially compared to squamous cells. So they have enough internal machinery where they can actually make glandular secretions or they can absorb nutrients. So you can kind of think of cuboidal and columnar cells as being big enough to hold stuff. And then stratified tissues are going to be much more protective than simple tissues because of their thickness. Simple tissues, like I said before, are better for diffusion and filtration. So what do those tissues do? We've kind of alluded to some of the functions. Simple squamous is great for filtration and diffusion, and in serous membranes, it can secrete lubricating substances. Stratified squamous can protect against abrasion. It's very thick, and so it has many protective layers, and usually the top layer is dead cells that it's okay if they slough off. So we can eat nachos without worrying. Then we have simple cuboidal, which secretes and absorbs in glands. Simple columnar, which can secrete and absorb, but mainly absorbs, especially in the small intestines, but it does sometimes secrete mucus and enzymes. Then pseudostratified columnar epithelium secretes mucus, and some of the ciliated tissues of pseudostratified moves the mucus. And then we have transitional epithelium, which allows the urinary organs to expand and stretch. But we can't forget glandular epithelium. So what we've just looked at were all of the 6 proper epithelial types. We talked about simple squamous, stratified squamous, simple columnar and simple cuboidal, pseudostratified columnar, and transitional. So those are definitely proper epithelial types that you should look back at and make sure you know or feel comfortable with questions about location and function. We're going to spend a very short time with glandular epithelium because we just want to know the basics against endocrine glands and exocrine glands. So essentially versus each other, because endocrine glands secrete hormones, whereas exocrine glands secrete things like digestive juices or sometimes enzymes. Endocrine glands have no ducts. They secrete their secretion directly into the blood. Whereas exocrine glands, they do have ducts, and they secrete their secretion into those ducts. And that secretion travels via the duct to an opening called a pore. Exocrine glands include those glands like sweat glands, oil glands called sebaceous glands, salivary glands, and any gland like mammary glands that produce milk in anyone that's lactating. So exocrine glands are those you're probably most familiar with, but you've probably heard of a couple of endocrine glands that secrete hormones, like the parathyroid gland that secretes parathyroid hormone, or thyroxine and insulin from other endocrine glands. Both insulin and glucagon, which are hormones directly secreted into the blood from the pancreas. So the pancreas is an endocrine gland, but it's also an exocrine gland. So there are going to be these circumstances where an organ could be both, but usually it's one or the other. All right, next we're going to be moving on to connective tissue, which is everywhere in your body, and connective tissue is definitely the most abundant and most diverse tissue in the body. You may be thinking, I thought that was epithelial. It makes sense to me that it's epithelial. But I'll tell you why exactly you're off, or technically wrong, in the next part of this video.